Hello, my name is Alicia Prather, and I'm a nurse practitioner student at Auburn University. My presentation is on the drug class Thrombin Inhibitors. This drug class includes the medication Pradaxa. This is the only medication that can be prescribed orally in this drug class. It acts directly on the formation of thrombin, preventing a blood clot from being formed. The pharmacodynamics of this medication is that it acts on the thrombin formation, preventing fibrinogen being converted into thrombin, causing the clotting cascade to be stopped. The pharmacotherapeutics of this drug class is that it is absorbed in the gastrointestinal tract, metabolized in the liver, and excreted in the kidneys. The distribution is unknown at this time. The half-life of this drug class is 12 to 17 hours. The pharmacotherapeutics of this drug class include precautions for spinal taps or surgical procedures due to an increased risk of bleeding, as well as taking any other form of anticoagulation or antiplatelet medication. Also, caution should be used in patients with renal impairment. It is absolutely contraindicated in patients already taking anticoagulants or antiplatelet medications, patients with heart valve replacements, and bleeding disorder. Thrombin inhibitors are a category X in pregnancy. There are adverse drug reactions with this medication, which include bleeding, dyspepsia, abdominal pain, and anaphylaxis. The drug interaction in this class includes other anticoagulant or antiplatelet medication. Do not use them concurrently with thrombin inhibitors as well as PGP inducers and inhibitors. They can affect absorption of these medications. The clinical use and indications for this drug class is to prevent thrombus formation, as well as prevention of strokes in patients with atrial fibrillation and myocardial infarction. The rationale drug selection on this medication class is limited due to only one medication in this class. This medication is rather expensive at around $400 a month. The monitoring for this drug class includes baseline labs, which include CBC, coagulation panel, liver and kidney function tests before you start the medication. There is no monthly monitoring with this medication. You will just get routine labs at your next visit appointment. It does not have to be monitored periodically. The education in this drug class is to educate patients on the risk of bleeding and bruising. They need to know to look for blood in their stool and emesis, nosebleed, and abnormal bruising. Patients need to be educated to use the original pill box because it can affect the medication, and they do not need to put it in a pill box or med planner. This medication also needs to be used within 4 months of opening the bottle. If not, it needs to be thrown away. This medication cannot be chewed. It has to be taken whole. They also need to be educated on black box warning for this medication for this drug class, because there is a risk of a hematoma formation with spinal tap as well as thrombotic events if this medication is abruptly stopped. The main takeaways from this presentation is that this drug class is used to prevent blood clots. You want to educate your patient on the risk of bleeding. They need to use their medication within 4 months of opening the bottle as well as using the original container. And also the black box warning of the risk of having thrombotic event if Pradaxa is stopped abruptly and developing a hematoma with a spinal tap. I have a presentation of a thrombin inhibitor, which is in this cup. And this is the blood clot. So when the thrombin inhibitor is poured into the container with the blood clot, it slowly dissolves the blood clot. Thank you.